So in this short video, I'm making this video for all the first year medicine residents who have newly joined into the residency. So I'm going to share you some tips and tricks which is going to help you throughout your first year medicine residency. So these are few very important points I feel that you should follow. The first and most important point is use of scrubs. So when you are using a normal clothes, for a medicine resident there is going to be at least 2 intubations in a day, or 2 or 3 CVP lines in a day, or when you are in emerge you will have multiple procedures. There are going to be definitely blood spillage, secretions and all. So I feel that you should have 3 sets of scrubs, so that you can send the first one for washing when you are done with it, so that when you are using your third one, you have at least one or the 2 pairs of your scrubs being washed and ironed to use for the next day. So this is very important. Make it an habit, because your normal clothes are going to take a lot of time to wash. The second and most important point is you should have a small sling bag. That sling bag should usually have a heme glucose test or your HGT machine, which is very important. Apart from that, you should have HGT strips. You should have a pulse oximeter, preferably a pulse oximeter with a rope and your labeling. And apart from that, a small hammer and some chocolates or fruit juices, because whenever you feel you're very exhausted, you can have some fruit juice or chocolate from your backpack. Apart from that, in most scenarios, the most important use of some instrument which is there, either it is a HGT machine where you're suspecting your patient is in hypoglycemia, he has become altered, which is very important because a lot of patients have hypoglycemia, they convulse. So it is very important to the first step to see is if the sugars are low, because if the sugars are low, that is a reversible cause of your altered sensorium, and if you treat it on time, your patient is revived. So this is very important, and you should have at least these 4 or 5 things in your small backpack. Make an habit with the scrubs and a small backpack, so that you have things handy in your backpack itself. So the third point is about how you should go through your ward work. So ICU is, I feel, better equipped already. So I feel that the most important instructions should be there, how you work in the ward. So the first and most important thing is to ensure a proper breakfast. Most of the times I used to go at 7 a.m. in the morning, because I used to instruct all my scopy patients to go for scopy, or I used to send the patients for CT scan, the relatives with the file. So it made me to go to the ward approximately 7:15 in the morning. I had to take rounds. So at this time hardly the hostel canteen or the college canteen is open. So I feel you should have bread jam with you, bread butter with you in your room. Apart from that, keep fruits with you. For the start of the day you can have them, and whenever you get time, after your rounds, you can go fast to your canteen, have at least idli dosa or some omelette, and come back to ward before the senior rounds. So this is very important. This is very important, the point that you are already in stress overall toward your first year residency. Apart from that, your appetite decreases because you are very busy in the work, and some of you might be very thin already. So if you keep this procedure, if you keep this habit of not having breakfast early in the morning, or avoiding your food, or decreasing your food intake throughout your residency, you might be at a risk of getting tuberculosis in the wards. Second point about this is that carry your CT alls with you in your backpack, and carry the photographs of the CT all of the patients during when you go to 2D echo. For example, you go for a 2D echo, but it takes time, half an hour, 45 minutes. You can write CT alls there. For example, if you go for CT scan, you go for MRI, and wherever you go for a procedure and you are asked to wait, you can fill on the CT scans, CT alls, so that your time is spared. In overall your residency, things are going to be hectic. You have to work smart so that you get time for rest, for sleep, and even if you want to go outside with your friends, so you have to squeeze time out of your first year residency to enjoy your first year residency and make some balance. Third point is be careful with a needle. So I had few experiences in my internship as well. I was very enthusiastic about procedures. I wanted to do procedures. I wanted to learn about PICC line, central line, subclavian line. So what I have learned from one of my seniors is that, for example, this is your syringe. So this does not have a needle at present, but when you when you are done with the syringe, you have taken a sample from the patient. The ideal point is that you will have your cover, which you should keep on the floor, and you have to take this syringe, take the cover, and put your hand on the bottom of your needle, so that you are nowhere close to the tip of the needle, and you should then fix your needle here and lock it, and then send it. So this is very important thing. It is most of the time what we do is we take the cap, we try to put it, and most of the time that time you have a needle prick, so avoid that. The other point is that when you put a center line, you use a center line, you put a center line, and when you remove the needle, after that, when you place your cannula and all, you are left with the step of suturing. So what you do with the suture is, most of the time you have needles which have linen in it, so you are supposed to pierce the skin with that. So most of the times what happen is, when your second hand or second finger is near it, you have chance of piercing the needle with your piercing the finger with your needle. So this is one crucial step we should be very slow with. Take your time to take sutures, because we as medicine residents are not very much in the flow to take sutures. So these are the two things which are very important, and I feel that if you have a proper needle prick, go to your CMO, take a proper stat dose of your post exposure prophylaxis within 2 hours. So that should be your ideal procedure, and try to avoid things try to avoid things so that you should not face those all 28 days of PEP and all those things. So the fourth thing I feel is that be careful with violent and altered patients. So a lot of times what happen is that we try to do procedures on a violent patient, the patient is not in a proper position, and we are like, okay, we'll take one relative with us and we'll try to put a central line it. You be very careful with those patients, because you never know what those patients are going to throw a hand at you, or they are going to move so that you will have a pneumothorax. So when you are doing a central line insertion, call a proper ward boy, let the time go, call a proper ward boy, call nurse. You can give already small doses of IM sedatives if you need, unless the patient is in delirium, unless the patient is in hypotension or in some other complications. So what you should do is give proper positions using your ward boy, take help of the nurse, and take time to do procedures, rather doing it in haste and having complications on you rather than the patient. A lot of times I have seen that patients, when we handle such violent patients, we perform central line insertion, which is definitely painful even after doing local anesthesia. So patients do collapse while procedure as a vasovagal, and they do not get revived. So it is better to go slowly. The fifth point is that I have seen a lot of residents taking consents after the procedure, or they don't take any consent. The first and most important point is that the consents are there for the patient to know the procedure. They should know all the things what they are going through. The other thing is that if you ever feel that the patient or the close relative does not understand the procedure, call your seniors, let them explain about the procedures. They have more experience than you to communicate with the relatives and talk to them and let them know what the procedure is. And never ever do a procedure without a proper consent, and explaining that what all complications are there. When you do a pleural tap, you explain them there is chance of pneumothorax, there is chance of hemothorax, there is chance of whatever complications can be there. So the relative should know that they are undergoing a procedure, they are signing for the same, and there is a risk associated with the procedure. And never ever take procedures after takes consent after the procedures, because if anywhere you get caught into the complication, it is going to be a medico legal problem. The last point which I feel in this video I'm going to tell you is that try to do all the procedures in a standard way. Try to give atropine before pleural tap to avoid for a vasovagal. Try to do bone marrow examination in a proper prone position with proper local anesthesia, with proper how to take smears for the slides and all, so that first of all you learn the important procedures, you avoid complications to the patients, which might happen when you are doing a faulty procedure. And the other thing is you can correlate things and you can understand why those procedures are being described in a standard way. So this is all about the first part about tips and tricks. Whatever I feel whatever I come across good points for you to tell you about what to read in first year or what to read in second year, and how to read in a very short way, in a very small way, which is going to be tips and tricks I will be putting in the next video. Thank you.